Hello learners, I am Professor Dr. Ruchika Kuba from School of Health Sciences, Indira Gandhi National Open University. Today I will be talking about concept of human health and well-being. Let us now think what is health? Different organizations and people have defined health differently. For example, the Oxford Dictionary defines health as a state of well-being in body or mind. The definition given in Webster's Dictionary states health as a condition of being sound in body, mind or spirit, and specially free from physical disease or pain. Now we consider, is health only an absence of disease? WHO has also come forth to define health as a state of complete physical, mental and social well-being, and not merely the absence of disease or infirmity. Thus, we see that health is not a one-time phenomena, but it is a continuous process. When we talk of health, we also need to talk about disease. How have we defined disease? Oxford Dictionary defines disease as the condition of body or some organ of body in which its functions are disrupted or deranged. The ecological definition states disease as a maladjustment of the human organism to the environment. So we reflect to think, is disease opposite to health? And very interestingly, WHO has not defined disease. We must understand that the health sickness spectrum is a spectrum of disease from unapparent or subclinical cases to a severe overt disease. Let us now talk about concept of health. The concept of health has been changing with time. At the very beginning, the health was conceived as a biomedical concept, that is absence of disease. But does the biomedical concept, that is just the absence of disease, also take into consideration problems like malnutrition or chronic disease? These are also diseases, but we cannot cover it under this concept. Another concept is an ecological concept, that is maladjustment of the psychosocial concept, human beings with the human beings to the environment. But can we just consider it in isolation? What about the role of health services? And if they are present, how will this have an impact on health and disease? Another concept is the psychosocial concept, which takes into consideration the social, psychological, cultural, economic and political factors which have a bearing on health. Again, under this concept, the infectious diseases do not figure. So we come to the latest concept, and that is of holistic health, which encompasses all these concepts, that is a biomedical, ecological and psychosocial concept. Do you know what we understand by dimensions of health? There are various dimensions in which health can be measured. For example, physical dimension, mental dimension and social dimension. The physical dimension basically deals with functioning of the human body. Now we can take history, and in the history we do need to ask, what is the diet like, what are the medications you are taking, whether you have been hospitalized or not, and also examination of in general and the systems that are there in the human body. So this gives us the physical dimension of a person, and we can assess whether he is healthy or having a disease. If we want to consider the mental dimension, then we need to see a balance between the individual and his surroundings. Psychological factors are considered to play a major role in various disorders like hypertension, peptic ulcer and asthma. As I said, the third dimension is the social dimension. The social dimension considers the social relationships as part of the broader concept of health. And when a person fails to perform these roles, for example, he neglects the social relations and indulges in bad habits, for example, crime, gambling, drinking, or resorts to homicide and suicide, he is considered as abnormal. There is a fourth dimension that we consider, and that is of a spiritual dimension. This is a dimension in which an individual feels committed to some higher being. And last but not the least is the emotional dimension. This dimension considers the cultural, socio-economic, vocational and educational aspects of health and disease. These are the aspects or dimensions which contribute the positive health of a person. Now talking about determinants of health, what are the factors which determine health? Now if you see in this figure, you can see that there are various factors which determine health. The first and foremost are the biological determinants. These determine the physical and mental traits of human beings, and to some extent these physical and mental traits are determined to some extent by heredity. For example, we have conditions like obesity, cancer, diabetes. Many of them have been attributed to have an inheritance linkage. Then we come to behavioral and socio-cultural determinants. For example, the lifestyle factors, considering diet, physical activity, smoking or the use of alcohol. The third dimension, the third determinant is environment. The environment could be an external environment or an internal environment. The internal environment is the functioning of the different tissues, organs, organ systems, and the external environment we consider as the physical, biological and psychosocial environment. Another determinant is the socio-economic condition of the person, that is, what is his economic status, what is his income, education and social status. All these have a bearing on health, whether he is able to afford certain status of living which will make him take certain things which, for example, clean water, he can access clean and fresh food. Next is the health services, that is availability and access of healthcare services is also an important factor which determines the health. The composition of the population, which is called demography, can also lead to an increase in chronic diseases because there are many factors, indirect factors that can have a bearing on the health of a person. For example, increase in the population can also result in overcrowding. It may result in an increase in the respiratory diseases. Similarly, an increase in the population can also lead to number of cars in the road, so they can lead to accidents. So there are large number of factors which indirectly affect our health. Now other factors which should be also be considered are, for example, food and agriculture, education, engineering, information technology, etc. Now we come to indicators of health. Let us look at the common indicators of health. The first and foremost are the mortality indicators. Now what are mortality indicators? Mortality indicators are related to the lifespan and the death in various categories of people. So we can have a crude death rate which tells us the average death rate in a particular population. We can have age specific death rates which are different for different age groups. Infant mortality rate is the death in infants, child mortality in children, maternal mortality in mothers during especially associated with delivery and lactation, and case fatality rate is associated with a particular disease. Life expectancy is the number of years that a person is expected to live. Then we come to the morbidity indicators. Basically, the morbidity indicators measure the extent of sickness. They are measured by two indicators. One is the incidence and the other is the prevalence. Incidence refers to the occurrence of new events or cases of a disease in a defined population over a specified period of time. For example, each season we get dengue cases. So we always talk about incidence of dengue in the month of July and August in a particular place. Prevalence, on the other hand, is the proportion of individuals in a population who have a particular disease or condition at a specified time, and it includes both new and old cases in a given population. For example, we may talk about tuberculosis in a particular place. For example, the number of cases of tuberculosis in Delhi. In such a situation, we will be talking about both new as well as the old cases. Third comes the disability indicators. These indicators give an indication of the extent of disability in a particular person. And we have three indicators, that is HALE, that is health adjusted life expectancy, the quality adjusted life year and the disability adjusted life years. Another important indication is the nutritional status indication. They tell us about the nutritional status of the group. Anthropometric measurements of the preschool children is an important indicator. We take 3 parameters for deciding this indicator, that is height, weight and mid-arm circumference. To find out that how the health is being delivered in a particular population, we talk about the healthcare delivery indicators. So, their distribution of the health resources in the different healthcare settings are considered under this. So, some of the indicators could be the doctor population ratio, the nurse population ratio, the doctor nurse ratio, the population bed ratio and the population per PHC or primary health center or a sub center. So, these tell us that how well equipped we are to be able to deal with the people or number of sick people in a particular area. Other indicators also are important, and these are health policy indicators, indicators of quality of life, mental health indicators, utilization rates, socio-economic and environmental indicators. Now, there have been various theories that why diseases are caused. 3 of these theories we are considering here. One is the supernatural causes, as per karma, that a person becomes sick because of the sins he has committed. Another theory is the theory of humors, that is because of imbalance of the fluids in the body. And the third theory is the miasmatic theory of disease, that is due to bad air. But the most important theory is the fourth theory, and that is the germ theory, which states that disease is caused because of certain microbes. Now, we come to another important factor which is also considered as a causative, which tells about the cause of disease, and that is the epidemiological triad. Now, this is based on the principle that agent, host and environment are 3 points in a triangle, and their interaction with each other is what produces a disease. You can see this diagram, and you can see that at the 3 vertices of the triangle we have got agent, host and environment. Agent is the organism which can cause the disease or the causative factor which can cause the disease. Host is the individual who will get the disease, and environment is the internal or the external environment, the factors of which decide whether the disease can be caused or not. Even if one of these 3 factors is absent, disease cannot occur. For example, if there is no agent, if there is no disease causing organism or situation, disease will not occur. If there is no person, there is only an agent and an environment, again disease will not occur. Similarly, we talk about environment. If the environment is favorable for causing disease, disease will occur. But otherwise, if the environment is healthy, no disease will occur even if the agent and host are available. So, it is very important that all these 3 should be in equilibrium so that no disease is caused. There are various multifactorial diseases which are caused by multiple factors like excess intake of fat, physical inactivity, smoking, etc. These are the causes for chronic diseases like coronary heart disease, diabetes, cancer, etc. We also consider a web of causation for explaining the cause of disease. Under this web of causation, there are multiple factors which can interact with each other to cause the disease. This is a diagram which shows the web of causation of a coronary artery disease. Let us now talk about natural history of disease. What do we understand by natural history of disease? This means that if we allow a disease to progress in its natural way without interfering in any way, that is, we don't give any vaccination, we do not give any antibiotics, we allow the disease to progress from the pre-pathogenic, that is before the person gets infected also, and the disease enters the body. From that phase till the termination of the disease is called a natural history of disease. The termination could be in the form of recovery, disability or death. So, this is a diagram which will show the various stages of the disease, it will show the natural history of the disease. Now, let us see what is meant by pre-pathogenic phase. Pre-pathogenic phase is the phase which is prior to the involvement of the host. The disease agent has not yet entered the host, but the factors which favor its interaction with the human host are already existing in the environment. This is the pre-pathogenic phase. For example, his immunity may be down, the environment may be very conducive, the right humidity, temperature may be available for the organism to multiply and enter the host. Then we have the pathogenic phase. The pathogenesis phase begins with the entry of the agent in the susceptible host. The disease agent will multiply and it will induce the tissue and the physiological changes, and because of this the disease organism will multiply and through in the incubation period, and then later on the symptoms and signs appear, and this is called the early and the late pathogenesis phase, when the disease symptoms and signs start appearing. When we talk of health and disease, it is also very important for us to talk about prevention of diseases, because it is more important, cost effective and also less troublesome to the person if we try to prevent disease. So, prevention actions are mainly aimed at eradicating, eliminating or minimizing the impact of disease and disability. There are 5 levels of prevention. Let us talk about these 5 levels of prevention. The first and foremost level of prevention is the primordial prevention. The actions and measures which inhibit the emergence of risk factors in the form of environmental, economic, social and behavioral conditions and cultural patterns of living is called the primordial prevention. For example, we do not allow a particular behavioral condition, for example, no exercise. So, if a person is not doing any exercise, then there are chances that he may get a particular disease. Similarly, if there is a stress in the work situation, a person may get prone to certain diseases like hypertension and diabetes. Second level of prevention is the primary prevention. That means the action is taken prior to the onset of disease, which removes the possibility of the disease. There are 2 steps in the primary prevention. One is the health promotion and the second is the specific protection. Now, the primary prevention can also be done on a mass scale when we target it to the population, and it has been found that if we target certain preventive measures to the whole population, irrespective of the individual level risk of the individuals, then also everybody gets benefited. For example, even a small reduction in the average blood pressure or the serum cholesterol of a population can produce a large reduction in the number of cardiovascular diseases in the particular population. The high risk strategy aims to bring the preventive care to individuals at special risk. So, for this we require to do certain screenings and we need to identify the people who are high risk, and we need to do certain interventional measures so that they do not fall into the disease category. Then we come to the secondary prevention. This is an action which halts the progress of a disease at its incipient stage and prevent complications. So, this basically includes early diagnosis by various screening tests or investigations, and after the diagnosis adequate treatment is to be provided so that there is quick recovery. The third level of prevention, or if you can also call it the 5th level of prevention, if we count the health promotion, specific protection as separate categories, then we come to the tertiary prevention. In this, all the measures available to reduce or limit impairments and disabilities are taken into consideration. We also try to promote the patient's adjustment to irremediable conditions. And so, these measures help to limit the disability and also promote rehabilitation in a particular person. So, we have come to an end of this chapter, but before we finish, we must understand a few terminologies. What do we mean by disability? Disability is any restriction or lack of ability to perform an activity in a manner or within the range considered normal for a human being. If he is not able to perform any activity that a normal human being should be able to perform, it is called disability. What is a handicap? Handicap is that because of a disability, if a person has a disadvantage, that will limit or prevent the fulfillment of a role in the community, that is called a handicap. For example, that if a person, because of his one paralytic leg, he is not able to take part in a race that is being organized in his school, then that becomes a handicap. Impairment, any loss or abnormality of the psychological, physiological or anatomical structure or function is called an impairment. Okay. So, for example, if he, because of a particular thing, he is not able to move his hand, he has got a fixed deformity in his hand, he is not able to move his hand, so that is an impairment. Rehabilitation means the combined and coordinated use of medical, social, educational and vocational measures for training and retraining the individual to the highest possible level of functional ability. Thank you.